think I need health insurance. Where can I go to get insured? Who can help me get covered? Is it too late? Can someone help me? Come on in. Let's get you covered. Can you help me get insured? What do I need to bring? Can my family get covered? Yes, I can help you. Bring income info, SS number, and household dependent info. Let's set you up. If you need help also, give us a call at 662-983-584.
Hi, my name is Tamika. I was working a job where I wasn't offered health insurance. I believe that having health care coverage is important. I spoke with Miss Candace, and Miss Candace helped me start a healthcare.gov account. She also helped me choose a plan that benefited my needs and my budget. I would like to recommend Miss Candace and Oak Hill to others for their insurance needs.
At healthcare.gov, millions more people can afford health coverage. In fact, 4 out of 5 customers can get a plan for under $10 a month. Open enrollment starts November 1st.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Encontré un plan que está buenísimo. Tú también deberías hacerlo.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Para mí es fundamental tener un seguro médico. Con la nueva ley puedo encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
I just wish more people knew how easy it was to get health coverage. I'm only paying $52 a month, but there are quality plans for even less.
My job doesn't offer health insurance, but with the new law, I found an affordable plan and only pay $47 a month.
Actually, a friend of mine recommended healthcare.gov, and now we're paying less than $60 a month for coverage.
I was skeptical at first, but it is real. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov. You know, I wish people knew how easy it was to get health coverage. This new law has made it so affordable. I'm only paying $52 a month, but there are quality plans for even less. New law, lower prices, more people qualify at healthcare.gov.
I went back to college right when I had to get off my dad's health insurance, so the new law came at a really great time. For $14 a month, my plan covers my meds, doctor's visits, vision, and dental.
New law, lower prices, more people qualify at healthcare.gov.
With me working part-time, my company does not offer health care. I was paying out of pocket until I heard about the new law. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov.
A friend of mine recommended healthcare.gov. I went to the website, put in all of our details. I was astonished at how much money we would be saving. Now we're paying less than $60 a month for coverage.
New law, lower prices, more people qualify at healthcare.gov.
Yeah,
Yeah, we are pregnant. We're having a baby.
the new healthcare law couldn't have come at a better time.
Yeah, because when you're pregnant, you need a lot of doctors.
For less than $30 a month, the whole family's covered.
New law, lower prices, more people qualify at healthcare.gov.
I'm pretty active, so I was happy to hear about the new law. I just plugged in what I needed. 20 minutes later, I picked a quality plan for less than $20 a month. So I'm covered for whatever I want to do.
New law, lower prices, more people qualify at healthcare.gov.
My job doesn't offer health insurance. With the new law, I found an affordable plan and only pay $47 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're both self-employed, and we couldn't find coverage anywhere near as affordable as healthcare.gov. Thankfully, we were able to find a plan for only $180 a month.
New law, lower prices, more people qualify at healthcare.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley, más personas como yo podemos encontrar un plan económico en cuidadodesalud.gov.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov.
How brave are you?
Like this much.
That much?
I love you, Dad.
I love you, baby.
Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov.
I want muffins.
New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley, más personas como yo podemos encontrar un plan económico en cuidadodesalud.gov.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
En cuidadodesalud.gov encontré un plan de salud que me cubre desde las visitas al doctor hasta mis recetas médicas. Tengo la tranquilidad de que mi salud está cubierta.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Siendo tutora trabajo con muchos niños, por eso para mí es fundamental tener un seguro médico. Con la nueva ley pude encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Encontré un plan que está buenísimo. Tú también deberías hacerlo.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Para mí es fundamental tener un seguro médico. Con la nueva ley puedo encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
You know, I wish people knew how easy it was to get health coverage. This new law has made it so affordable, I'm only paying $52 a month, but there are quality plans for even less. New law, lower prices, more people qualify at healthcare.gov.
I went back to college right when I had to get off my dad's health insurance. So the new law came at a really great time. For $14 a month, my plan covers my meds, doctor's visits, vision, and dental.
New law, lower prices, more people qualify at healthcare.gov.
With me working part-time, my company does not offer health care. I was paying out of pocket until I heard about the new law. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov.
A friend of mine recommended healthcare.gov. I went to the website, put in all of our details. I was astonished at how much money we would be saving. Now we're paying less than $60 a month for coverage.
New law, lower prices, more people qualify at healthcare.gov.
Yeah,
Yeah, we are pregnant. We're having a baby.
the new healthcare law couldn't have come at a better time.
Yeah, because when you're pregnant, you need a lot of doctors.
For less than $30 a month, the whole family's covered.
New law, lower prices, more people qualify at healthcare.gov.
I'm pretty active, so I was happy to hear about the new law. I just plugged in what I needed. 20 minutes later, I picked a quality plan for less than $20 a month. So I'm covered for whatever I want to do.
New law, lower prices, more people qualify at healthcare.gov.
My job doesn't offer health insurance. With the new law, I found an affordable plan and only pay $47 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're both self-employed, and we couldn't find coverage anywhere near as affordable as healthcare.gov. Thankfully, we were able to find a plan for only $180 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're having a baby, so the new law came at a perfect time. For less than $30 a month, the whole family is covered.
I love my job and it pays really well. There's just no health coverage. For $182 a month, I found the perfect plan.
All that stress about coverage just went away. For $14 a month, my plan covers my meds, vision, and dental.
Now, more people can get financial assistance. What you pay depends in part on how much you make. New law, lower prices, more people qualify at healthcare.gov.
Take care of your joy, your hopes, and your health. Go to healthcare.gov to shop for quality plans that are right for you. New law, lower prices. More people qualify at healthcare.gov.
Mag-sign up para maprotektahan ang iyong kalusugan. Mag-sign up para maprotektahan ang kalusugan ng iyong pamilya. Mas affordable na ngayon ang healthcare insurance ayon sa bagong batas. 4 sa 5 customers ang makakakuha ng plan na mas mura pa sa $10 kada buwan. Tumawag sa 1-800-318-2596 ngayon.
Ghi danh để bảo vệ sức khỏe của quý vị.
Ghi danh để bảo vệ sức khỏe gia đình của quý vị. Bảo hiểm sức khỏe hiện đã có giá phải chăng hơn nhờ vào luật mới. 4 trong 5 khách hàng có thể tìm được bảo hiểm chỉ 10 đồng một tháng hoặc ít hơn. Gọi 1-800-318-2596 ngay hôm nay.
报名投保保障健康，报名投保保障家人健康。新的法律让健保现在更易负担，每5位客户就有4位能得到每月低于10美元的健保计划。请致电1800-318-2596。
अपनी सेहत के लिए साइन अप कीजिए अपने परिवार की सेहत के लिए। एक नए कानून के कारण अब और ज्यादा लोग हेल्थ इंश्योरेंस अफोर्ड कर सकते हैं। 5 में से 4 कस्टमर्स को मिलता है एक प्लान जो है $10 या कम पर मंथ। Call 1-800-318-2596 today。
登記投保，保障健康；登記投保，保障家人嘅健康。而家新嘅法律令健康保險更容易負擔。5位客戶當中有4位可以揾到每個月低於10蚊美金嘅健康保險計劃。打電話1800-318-2596。
건강을 지키기 위해 가입하세요. 가족의 건강을 지키기 위해 가입하세요. 새로운 법률로 이제 건강보험료가 더 낮아집니다. 5명 중 4명의 고객이 월 10불 이하의 플랜을 찾을 수 있습니다. 오늘 1800-318-2596으로 전화하세요.
My name is Jamie Fontaine and I'm 27 years old. My friends who have worked service jobs and I all have this theory that you should have to work a service job for at least 2 years so that you know how to act in public. I've been working
Hello, everyone. Can everyone hear me? Yes. Okay, awesome. My name is Sharita Smith. I live in Holly Springs. I am a navigator for the North Mississippi area. I'm currently employed with the ICS Head Start. I'm a family health specialist. And I currently do work with Health Kids Mississippi at the Oak Hill Regional Community Development Corporation. And a couple of things I want to discuss with y'all with healthcare. Everybody needs it. All of us, not one person, not just your children or just you, everybody. Because we all know healthcare can be very expensive. So please, with everything that is happening now, it is too expensive not to have health coverage. With the Affordable Care Act, you can still get insurance with a pre-existing illness, which is awesome because we all know those medications are high. Please do not risk a gap in your insurance coverage. Do not risk a gap in your children's insurance coverage. You can give any of us a call. We have navigators all around Marshall County and Benton County. I have Marshall and Benton County areas. As we all know, our Medicaid office shut down here in Holly Springs in July earlier this year. So therefore, you will have us to be able to call and get us to help you with renewal or even signing up for insurance. Because our Medicaid office did move to Oxford, and that is a good little drive for us. Our goals are to help create healthier communities for all, connect customers to the right resources, and choose a health coverage that is right for you, your family, your budget, because only you know what you can afford. The only thing you have to lose is a few minutes of your time. However, that few minutes could be the biggest blessing you could ever have. If you decide that this insurance is still too expensive for you or in your budget, we can definitely give you information on local federally qualified community health centers because they are just as good. And they're also offer sliding fees. So it's income-based still, but you won't have to pay as much. And we all know we all need those preventative services. My current hours right now, I work 5 to 9, Monday through Friday. Saturday and Sunday, 9 to 4. If you need help with applying or renewing the health coverage, please do not hesitate to give us a call. Our main office is in Hernando, and the phone number is 662-298-3584. My personal cell is 662-544-0265. Please, please, please do not hesitate to give us a call. Thank you so much for listening to me. Now let's get covered and stay covered. Thank you.
Good evening. Good evening. Hold on. Give me a minute. Can you hear me, Anise? Hello, hello, hello.
Yes, I can. Yes, I can hear you. Go ahead.
Okay, but I don't have my picture, so I'm still trying to work on that, okay? But I am Loretta Miller. Am I there? Oh, could be. And today is November 1st. Not just the first day of November, but the first day of open enrollment. It is a time that we're going to be available for anyone that does not have insurance or wants to make changes to their insurance on the marketplace. So open enrollment is today, begins November 1st. It ends January 15th. I invite each of you to join us for open enrollment. I can add a personal note to that because I currently have insurance through the marketplace, and it has worked well for me. I was actually in the donut hole between 60 and 65. So the insurance was great. It worked well. Ended up getting a advanced premium tax credit, which was another good thing. So we ask that you join us, call us, reach out to us, text us. It's open enrollment time, and we are available to you. Join us. You can call us at the office, 662-298-3584. The number is listed on our, try to pin it to the screen. Yeah, okay. The number is 662-298-3584. Someone is there to assist you. Give us a call. It is open enrollment. Thanks, everyone. I'm back again. Did you know that there were 10 essential benefits that every plan that is on the marketplace covers? All plans on the marketplace cover these 10 essentials. And there are things that are applicable to us as just regular people that are important to us, things that we need just for regular hospital visits or regular visits to our annual physicals. So, and there are things to have just in case something happens. We have prescription drugs. So I know a lot of us might be on prescription drugs. So of course, the ACA plans cover those prescription drugs. Might be something for high blood pressure, for diabetes. All of those are covered in your ACA plan. For rehabilitation services or habilitative. So if you're addicted to something, those plans are covered. Services and devices are covered. Lab services, if you need to send your blood work out or need to have your A1C checked, or if there are things, special testings that you need to do at your regular office, those things are covered on your ACA, all of the plans on ACA, on the marketplace. Additionally, preventive and wellness services. So that would fall like our annual physical, where we go and the annual physical, they check everything. Those are covered. They some annual physicals check your eyes, check your hearing, they check your blood, they check your heart, they check for kidney problems. They give you a urinalysis test for those things. All of those preventive services are covered in that physical or wellness services. And by the way, some of the carriers that are on a part of the marketplace will have some incentives for you if you continue with those wellness services and wellness checks. Pediatric services for your child, that's covered on the plan. Mental health and substance abuse disorder services. I know a lot of times we don't talk about mental health, but there are a number of things covered when it deals with our health. We need to be healthy physically as well as mentally. It does not bother you or does not make you a statistic, or does not stigmatize you if you get some mental health or just talk to someone. Those things are covered under the Affordable Care Act. Pregnancy, maternity, newborn care. I remember, this might be dating my age. I remember years ago when I had my children, which are now 40, but we had a self-insured policy, and they were talking about, well, we only cover the baby if they're up to a certain age. Well, the good thing was they covered me throughout the pregnancy, but the ACA now covers the newborn. So just in case something happens to the baby, maybe there's some special treatment or special, I don't know, watch that your child might need, special services, just might be looking, maybe it's something with their blood or anything. All of that's covered with the plans at the marketplace. So hospitalization, that's covered. Emergency services, that's covered. Ambulatory service, all of those things are covered on the marketplace, which makes it a great place to go. You'll have to shop for the insurance. So I invite you to take some time, go through, put your information in, or just window shop, use the window shopping tool. Go through and take your time and look at each plan. They come in different categories. You can get a bronze plan that's 80-40. You give a silver plan. Silver plan that's 60-40, 70-30. You can get a gold plan that's 80-20, or you can get a platinum plan that's 90-10. Now, of course, yes, you're asking about that. That means on the platinum, you pay 90%, you pay 10%, and your insurance coverage is 90%. The table is spread. Take your time. If you want a gold plan, you pay 20% of any of the services that are on your EOB or your explanation of benefits that you receive every time you go to the doctor. Either you pay 20% and the marketplace pays 80%, Or if you're on the silver plan, silver plan, it's 80, you pay, the plan pays 20, the plan pays 80, you pay 20. If you're on the bronze, the plan pays 60 and you pay 40. It's any kind of style that you want. It's a menu that's out there. Go to the marketplace, call us at the Hill, Oak Hill, Regional CDC, get covered. We want all Mississippians covered. You have questions, just call us. Go to the site. If you just want to ask questions, come by the office, just ask questions. It is open enrollment day. Today is the first day. You don't want to wait till the last minute because there are a number of plans and it takes time to go through the plans and find something that's set for your budget. So today is open enrollment. We're there for you. We're here for you. 10 essential benefits. Get covered, Mississippi. You need any help? Give us, call us, text us, email us, come by the office. We are available. We're here for you. It is open enrollment. So we have November 1st through January 15. If you come into the office and you find a plan in November, we know that you'll be able to start January 1st. You don't want to wait till the last minute to start a plan, to be enrolled in insurance. Come and join us. It is available for you. Open enrollment, November 1 through January 15. Thanks. Dr. Minor. Dr. Minor, got a quick question for you.
Yes, this is Loretta.
Quick question for you. How many counties in the state of Mississippi?
There are 82 counties in the great state of Mississippi, and we are glad that we are broadcasting live to all 82 of them across the great state of Mississippi. We thank everybody for joining us, whether you're down on the coast, down there in Forest or Jackson County, or whether you're up north, DeSoto, Tate, or down the Delta, Bolivar, Washington, out in East Central Mississippi, or either in Lauderdale County, or wherever you are, or in the east part of the state, where you're in Lee County, wherever you are, we're glad that you're joining us on today. Thank you, Sister Loretta.
So you mean to tell me that they can get insurance in all 92 counties?
In all 82 counties. Wow.
I mean, 82 counties?
82 counties. Yes, it is available in all 82 counties. That's correct.
And we have representatives that they can reach out to in all 82 counties?
Right. Well, the thing about it is that we work on a hub and spoke system. And so that anybody can make a call to 662-298-3584. Sometimes we're able to handle it over the phone. If we need to make an appointment with them, we can do so. And they can join, we can connect them with one of our navigators, set up an appointment, or we may connect them with one of our certified application counselors who will be more than happy to assist them through our federally qualified community health centers.
Wow, that's awesome. That's awesome. It is first day of open enrollment. I urge you, all us, covered January 1, starts today, November 1 to January 15th. Don't wait till the last. Call us.
Right.
I agree with you, Miss Loretta and Dr. Mount. I got my first one today at 1 o'clock. So
all right, so we got it. Ring, ring, ring the bell. We got it lined up and rolling up. And as soon as I get through with this webinar, this telethon, everything's all set for Sister Mine and I'm just gonna go through and review the plans, and I know I'm gonna get busy helping all the folks across the state of Mississippi. So I'm gonna go ahead tonight and get everything all set with ours. So I want to practice what I preach. And I have it done by December 15th. So when January 1st rolls around, my coverage continues. I have been a happy consumer. I've been on the Affordable Care Act, my wife and I, since January 1st, 2014. And I want you to know it has been great coverage. Great coverage. All the hospitals. Nobody looks at it like it's secondary insurance and everything. Now, Sister Mine and I are blessed, and the Lord has blessed us to do pretty well financially. So we don't qualify for the subsidies, but I'm cool with that because before that time, I was unable to have coverage. As I always tell folks, I'm so glad because of my faith, I have assurance, but I'm added to that some insurance. So if you got assurance and insurance, you're batting 1,000.
Amen.
Wow.
Wow.
So pre-existing conditions are covered?
Pre-existing condition could cover it, and that was my problem. The reason why I couldn't get on one of those other plans is because I had a pre-existing condition. We got one of those skimpy plans. My wife was able to get on. It didn't cover very much, but she had something. But I couldn't even get on a bare bones hospitalization plan because of pre-existing. And so we're excited about that. Look, that must be Sister Hill. Sister Hill, there you go. I was going to say that back. Sister Hill has been doing a great job for us for Mid-South churches down in the Mississippi Delta, down Renova, the Cleveland area. So we thank for all of the hard work. They got Head Start folks. They've been doing a great job. Our Head Start folks have been doing a great job across the state.
I'm moving into
Sister Hill, turn your TV off there, Sister Hill. Sister Hill, yeah, turn the TV off there. Yeah, let me get that background noise. We can work. We're doing this live. You know, this is a live telethon.
I'm sorry about that. I had that.
She's excited.
I'm excited. I'm moving into the Humphreys County, so I'm moving close. We're doing that, and got to take a trip down to Humphreys County.
All right, we're still in the Mississippi Delta, and the good news is that everybody we work with will end up with a connection. The concern that we've had, and let's just be honest, when we first started this, that we only thought about the Affordable Care Act, and we didn't realize how blessed we are in Mississippi. It has such a strong network. We are the birthplace of federally qualified community health centers. So we have a continuum of opportunities for people. If you come to us and you're not able to qualify for the ACA, I mean, everybody's qualified, but the premium is too much. You see if you qualify for Medicaid or CHIP. That doesn't work. We'll do a facilitated referral to one of the states, over 200 locations for federally qualified community health centers.
So what do they do at the federally
qualified community health centers? Well, you know, it's not free care, but it's done on a sliding fee scale. They got great coverage, and in many places, like in Coldwater, for Anthony Henry Community Health Service Centers, their MJ Edwards Center, which is always funny, a little inside joke for us in the Memphis metro area, because MJ Edwards has been most noted for being a funeral home. So usually if you're taking your loved one your mom or dad to MJ Edwards, it was like, oh, well, they're dead. But now it's an MJ Edwards Community Health Center. And before he died, he donated the land. He kind of joked about that. You know, he wanted to say that, hey, MJ Edwards can also be considered of people being alive. But in any event,
good job.
My mom goes there. She's on Medicare. She gets great coverage. In many of the communities, there aren't any other medical professionals other than the federal qualified community health centers. So go there. It's great coverage. They have great network, and they can take care of you all across the state of Mississippi.
Wow. Very good. Good job. Good job.
Good job.
If I don't qualify for advanced premium tax credit, don't have insurance at work, wow, I can care. And this entire network, we got something for everybody.
You see what now?
We have something for everybody. We can help.
Yes, we can make a connection. That's the thing we pride ourselves on, that whoever you are, wherever you are in the state, we can find a way that you'll be able to connect to a health professional. That's important. And of course, let's not de-emphasize the importance of staying healthy.
Yes.
The thing is try to have insurance for your preventive services, that you're going for your regular checkups.
Right.
And there's not that need for you to have to run in. You know what, I heard several people say, I take this high blood pressure pill so I can eat whatever I want to. Well, that high blood pressure pill is all part of a healthy diet and everything else that we're doing.
Okay.
So Sister Hill, you said that you had an appointment today at 1:00.
Yeah, Miss Tribbett, yes. Miss Tribbett came over out here. Yes, she did. I just got to finish it up, but I think she'll be all right. Yeah, I had an appointment at 1. Yes.
All right. No, the first day, look at that. We rolling, y'all. So look, get covered, Mississippi. Look, get this number, write it down, 662-298-3584. We're going to stay over a little bit later today, respond to some of y'all's phone calls and everything. As Duke said, you can text us as well. We're going to put that in the chat so that you can do the text piece as well. And look, Sister Loretta, one of the things that I'm excited about is this year we're going to have more people than ever before. They're going to renew coverage.
No.
We're going to renew coverage.
Wow.
Renew coverage.
Wow. So we have Head Start. We have boat people all the way down in the Gulf Coast.
Yeah.
That's right. We cover the whole coast. And I told Brother Danny and Song and all of them down there at boat people in Mercy Housing that we owe them a trip. We hadn't been down since 2018. So we'll be going down there. I'm making plans to fly down there. I don't drive that far anymore. So that's a long drive. It's about 6 hours from going down there. But we're going to fly in and we're going to go and check in with our team Gulf Coast, doing an amazing job with the Vietnamese community, the fishermen. I don't know if you know it or not, but Oak Hill Regional CDC, through Healthy Kids and Get Covered Mississippi, we're one of the biggest supporters of Vietnamese health services in the state of Mississippi. And we're really pleased with that.
Wow. Yeah. That to be proud of.
But everything has been exciting. As I taken that mental class, the lady said, boom, boom, boom. That means it's been exciting today. I tell you, it's been good. It's really has. And
we have some more surprises coming for you all that we're going to transition, I think about 7 tonight. And we're going to transition over to the National Baptist webinar. And we have some special guests. The reason we're doing this, we have some special guests from the U.S. Department of Health and Human Services who are going to be on the call tonight. Yes. So those of you that are watching on our social media, we're going to stream or share and have it there. But special guests, the first day open enrollment, this is the first time we're able to do it. We got some special guests from the U.S. Department of Health and Human Services who are going to be here to answer some questions, not only about the ACA, but Medicare open enrollment as well.
Dr. Mott, I thought about something.
What's that?
What if I don't have a job right now? No, what if I do have a job and I sign up for a great plan on the marketplace? You guys help me and we give me a good plan and I'm working and it's going well. Then all of a sudden, I get a raise. What do I do?
Well, the first thing you need to do is thank God that you're making a little bit more. But in all seriousness, with respect to the ACA, you should go to healthcare.gov and open up your account and do that change, because that could affect your advanced premium tax credit. So anytime there's a life change, whether it's income, you get married, get divorced, adopt a kid, those things that come up. And look, I apologize for y'all that are hearing the background noise of my neighbor's dog. I'm here, they're doing some work in my home office. And so I'm here on the hotspot and the laptop, but it's good. It's a nice fall evening here in the Mid-South.
So what if it's after January 15th?
Well, if it's after January 15th, if you under 150% of the federal poverty level, you can have a special enrollment period. No questions asked. For anybody that's under 150% of the federal poverty level, you can apply for the ACA. Other than that, you can see if you qualify for the SCP, because, as we talked about before, you lose your job, you have a life change, you get married, have a kid. You can go into healthcare.gov and look at one of those things and see if you qualify. And of course, other than all those things, we can look at you connecting with a federally qualified community health center. I will say that we've been amazed every week. I say this every week in our monthly reporting, in our weekly reporting, we have people who we have referred to the VA. We find that simply amazing, since we figure that people ought to know that if you served, that you will qualify for that. But every week we make referrals. So we want to just make emphasis that there are a lot of people out there that are veterans, don't realize they have not applied for their benefits.
Okay. I just wanted to know that, just in case. I didn't want to be afraid of going in and signing up and then something happened and I'm not able to make my premium. I just want to make sure that I have a safety net. So that's
right. We're gonna do that. And then unlike last year, unlike last year and previous years, the previous, I guess, 4 years, if people, 3 years, I think it was, that people that had a problem, they didn't make all their premium payments, they were prevented from applying in the next year. That's no longer the case. If for something happened and you didn't start it out and you were unable, and your policy was canceled because you weren't able to complete making your payments, you may have lost your job, anything could happen. We don't understand those things go. You can still apply. I would just say this, no matter what, just apply, especially with one of our navigators. The worst thing that happened is you just lose a little bit of time, but you may find yourself with some unbelievably good coverage. So just apply. Call us 662-298-3584. Again, that's 662-298-3584. And we'll connect you with a navigator that can assist you. If you are one of those savvy people, you can go to our website, getcoveredms.org, and you can get some information there. That used to be, Sister Loretta, we had to help folks from A to Z. Now sometimes we just help them from Y to Z. But whatever, we're here to help you.
Gotcha. We're here to help. That's right.
Right. And we're looking forward to, I think we got one more break coming in at 6:30, if I'm not mistaken. We're looking forward to 6:30 for having our Team Head Start to wrap us up. They come in this evening. And look, the whistle, Catelli Ramsey had the whistle. I was like, wow, I thought something was going wrong with the Zoom or something. But she had a whistle saying, it's time, get ready.
Very good.
But the ACA, it's like, wow, man. People really
I don't have any pom-poms.
I know, it's like, wow, it's time. It's time to get ready for this and to make it happen.
Yes.
All right.
Yes.
All right.
Okay.
Hey, look, I got some mail today. Hey, the mail, I can't say the mail, the postal worker, the mail lady. Wow, she put a lot of letters in my mailbox. Must be some bills. I'm gonna bring them over to your house, Sister Loretta.
No, I have enough. Thank you very much. Everybody wants to tell me what insurance I need and what's best for me. I think
But one thing I tell you, Sister Loretta, I can tell you one thing that I don't have to worry about. Not one of those bills is a big hospital bill. I can tell you there may be some doctor bills and some a little co-pays and stuff, but I ain't got a bill in there for no $20,000 or $30,000 that I can't pay.
Thank the Lord. Right.
Yes.
Well, yes.
There's
Well,
not
I have
one
a
of those
lot
in my
of them.
mailbox.
Choose
It's
this
not there.
plan. Choose this plan. Choose this
Yeah,
plan.
get your plan. Get covered. Get covered today. Get covered. Get covered.
Yeah.
If you're a person of faith, you got the assurance. But if you got some something to add to that, get some insurance. So if you got
That's right.
assurance and insurance, wow.
Dr. Miles, that's what Mr. Johnson said too when he had his heart monitor surgery from Vantage. He said he didn't have no big hospital bill. They paid all his stuff, X-rays, everything, going back and forth. They paid for.
Yes.
He ain't got no big doctor bill.
That's wonderful.
That's my very first customer.
That's so wonderful.
Mhm.
Wow.
And then they even when the day before the surgery, they even gave him money to go to a hotel to spend the night because he had to come from the Delta to there. That he didn't have to get up the next morning and drive all the way to Jackson.
You can't beat that with a stick.
I'm telling you,
about.
I ain't never seen one that pay for a hotel for you to come to stay and then be in surgery for the next day.
All right, look, that is a true story. Being covered.
Being covered. Covered with ACA coverage.
ACA coverage. People try to call us Mickey Mouse. Yeah,
Mickey
well,
Mouse.
you know, you can call it Mickey Mouse, but it's a good mouse. Yeah, because it's working.
Yes.
Yes, Lord.
And he's yet alive.
Yet alive.
Because you hadn't had that surgery. Wow. You don't even want to think how it would have been.
Would have been.
Yeah. Thank the Lord.
Thank the Lord.
Yeah.
And then look, I know for those people said I can go to the ER.
Mhm.
Yeah, you can go to the ER, but they're gonna stabilize you.
They're gonna stabilize, that's right.
And they're gonna send you home.
Send you
They're
home.
gonna stabilize you, send you home, maybe with a week's worth of medication. All right. And then you're on your own.
Until you see your regular doctor.
That's right. See regular doctor.
And then the reason you're in the ER because you not a regular and you don't have a doctor.
You have a doctor.
That brings a good point. I remember in working with the ACA when it first started.
Yeah.
And I found out that a lot of people use the ER as their doctor.
As their doctor.
Oh, yeah.
Right.
With ACA, you'll have
they're having fun with us now, Sister Loretta. They're saying that this is the Dr. Miles and Loretta show. Oh. Well, add Sister Hill to it. We'll make it the three of us. Just like
well, I have ACA. I have insurance on the marketplace. So
yeah, there you go.
Yeah, I do too. I'm a happy customer.
Happy.
Thank you. We are.
Happy customer.
And we're healthy. We're healthy. See?
And hopefully I'm gonna be happy with the people that doing work in my office here. So because it's getting darker and darker in this out here in this truck. Let me see. Let me turn this other outside light on. That's not gonna work right here. Let me see. Yeah, that's a little more light. Let me turn to the light here. Because in a minute it's gonna get good and dark. So I'm already dark. I don't want to get dark and you can't see me.
Oh my goodness.
Okay. So there's a little bit of light there. I'll bring some more. I have turned the headlights on in front here. So we can get everything done. There goes my neighbor. All right. All right, it's Pastor Westbrook.
He's not talking about the insurance.
No, he's not.
No, the reason why I'm saying that is because Pastor Tommy Westbrook is one of our navigators.
Oh, okay.
And he's working with us, with our churches, the Head Start churches, some of the pastors to encourage them to share about the ACA. So they can come in and line some things up and be able to direct some more people.
Right. Each one.
I tell preachers all the time, you want to connect people with coverage because the less money they have to pay for medications and hospital bills, the more money they have to give and offer it. Yeah.
To thank God for them being healthy.
Yeah, being healthy. That's right. Being healthy.
That's right.
Being healthy. And you know, we've averaged about 20 people on the call all day.
Oh.
Let's say, I'm trying to say what areas we got on here. So we got So we got the Delta represented. We got Head Start, North Mississippi. We got headquarters.
Yeah, Jackson.
And Brother Clarence, you better watch Brother Clarence. He was at me rolling today, talking about Michigan. He's been there so long. They're from Hernando, Michigan. That was fun.
Hernando, Michigan. He did
All
say
right.
that.
All right. And
Yeah, I know
Sister
he's glad to
Stigler-
be here.
Yeah, and Sister Stigler's from the greatest county there is in Mississippi, Tate County. Yeah, May Stigler in Tate County. And we got some more Head Start folks here.
Yeah.
Amen. All right, Head Start well represented. We got some great Head Start folks. They were there having their pictures in front of the cover signs.
Okay. I tried to give Duke one of those pictures. Get covered.
We saw your picture.
Okay, I didn't get a chance to see it. I have a quick question. So it's Sister Berta. So we can still actually talk to people who speak little or no English?
Well, in addition to the
Spanish?
person that, for those that are the ICS Head Start, they have a person on staff, but we also have a bilingual specialist here. We have a specialist from the University of Southern Mississippi that we've engaged. We want to get a top-notch specialist,
right?
That is both a navigator and can speak Spanish. His name is Mario Jefferson, and he's there for those times that we have to be able to work with us. And of course, on the coast, all of our navigators, well, most of our navigators on the coast are bilingual in English and Vietnamese. So far in the East Central Mississippi, for the few that we had to work with in the Choctaw Nation, we've been able to work with them, with some of their leaders. And so since most time they use the Indian Health Service, we haven't had a lot of people who sign up through the ACA, but we are connected and ready to work with residents of the Choctaw Nation in East Central Mississippi.
So what group of people do you not touch?
Well, because we can call the healthcare.gov and have a translated services, we really think there's not anybody. So if you can speak, we can find a way to communicate with you. Let's put it that way.
Okay.
So to do that, we can make that happen.
Good job.
We can make that happen.
Good job.
And we got Metro Jackson, Dr. Tyler's still on. They had a good session today. Church Women United, we're doing a lot of things down there. Also with new birth individuals. Do that, try to help them out early on. And we do challenge all the churches. Anybody in the churches that are watching, the pastors that are watching, members of churches, those in your community that have just had a baby, consider adopting them for a year.
Yeah.
And look, don't try to give them a supplement, but from time to time, if they need some help with diapers or formula or something else like that, we can do that. We can connect because the churches should be about service. Our motto at the church, the Hill, where I pastor, is dedicated to service after the benediction. So we're certainly challenging all the churches to, especially now the pandemic's gotten better, to come and be supportive of these new birth individuals.
Right. Okay. Because a lot of times it's medical bills that really shake us for a loop and shake our foundation.
Yes, it does.
Insurance. Yeah.
Yeah, it does. It does. All right.
Pastor Montgomery.
Good evening again with this great kickoff opportunity. And certainly we pray that we made field goal, we made extra points, and our delivery today with all the expert and those things that has been laid out before us all day long. Thank Dr. Minor and certainly Duke with the technical part of what we're trying to do. If we just take a great recap of some of the things that we mentioned earlier today, certainly I want to say that let's remember, we got to pay that premium. Got to get that premium paid with the excitement of getting the plan and looking at the great benefits and an opportunity and all the amazement with the fact that it probably didn't look like you thought it would look, as a blessing and benefits that you didn't think you were able to get. Now that you're clapping, jumping and running and thinking and certainly giving that information out, let's get the premium paid. And in the process of selecting your plan, consider I understand the cost of the plan, but also consider the benefits. What plan that you're going to benefit you more than perhaps a higher deductible. So those things need to be weighed. It's wonderful if you can get someone again to help you select your plan. Now, can't any of the navigators do that? They can go as far as giving you the information, education you, and running you and taking you through the system and those type of things and answering questions. But at the end of the day, it will be your responsibility to select the plan. And I believe that we got great expert people that is able to do that. And they have a wonderful amount of patience. Remember, that's the same question over again so that we can assure you what you're getting in this great plan. Again, we've got until January the 15th, but those of you that immediately, please don't wait because the holidays are coming up. There's other things that you want to do so that you can get this behind you and have insurance. And during this holidays, Thanksgiving and Christmas, that you have the opportunity to share with your community, family, and your friends. Behind me, it says affordable. Let me see, can I get it? I'm going the wrong way. Affordable Care Act. And that's really what it means. It's not an act, but it's actually for real. So let's do it. Let's spread the word. And again, we at our headquarters, 662-298-3584. And if you have a question, even tomorrow, of some of the things that you heard repeated over and over again, we are here to serve. Again, I'm the vice president for Mid-South Churches Corporate Conference Baptist Convention. Again, that consists of the state of Tennessee, Mississippi, and Arkansas. Again, we cannot enroll anyone outside of the state of Mississippi, but certainly with our navigators and with our headquarters, we try to communicate with those contacts outside of the state of Mississippi. So therefore, if we get any question, we can make those refers to those locations and you can get that assistance. And again, with the blessing part of being Mid-South Churches is because of the national events that with webinars, and we have people on for Mississippi that do ask questions concerning get covered, the Affordable Care and those Healthy Kids Mississippi, and it rings a bell or sends up what we consider a notice for other states, and we do, and we'll answer questions, but however, we do not educate anybody the things that goes on in the state of Mississippi that is outside of Mississippi, because different states may have different qualifications, but certainly in the Affordable Care Act, remember, 10 essential benefits. So therefore, when you approach from anyone, ask them, are they from the marketplace, and do they have the 10 essential benefits that go along with the Obamacare? And we look back to see where we were years ago and where we are now. Look at those are the 10 essential that are covered: ambulatory patient service, emergency service, hospitalization, pregnancy, maternity, newborn care, mental health and substance use disorder service, prescription drug, rehabilitative and habilitative service and devices, laboratory service, preventative and wellness service, and pediatric service. Look at that. All of them are checked. So let's make sure that while we are getting into this season, while we are deceiving of giving, thank God for the assurance, as Dr. Minor would say, but certainly we need the insurance as well. We believe that God wants us to be healthy on this side of what, as far as Christianity of glory. So certainly get involved, be a part of this. There are no boundaries. You don't have to be a church that's a part of Mid-South Churches to be a part of what we're trying to do. But certainly we do pray and hope that you become a part of this, and just help us get the information out. Help us to gather others and give them the confidence that this actually works. And we understand that there's some predatory companies up there or individuals that will prey on you as far as your information. But what we do is your information is secure. None of the information that we will use where you'll be caught up in anything else. What we ask that you do is certainly be truthful with the information that you, once you start your application and you become aware and apply for these benefits, just be truthful and upfront, because there's a check and balance at the end of the day. So certainly let's go ahead on and get involved. And certainly I want to give this team a thumbs up, a pat on the back, a hug, congratulations for the efforts in which we were doing. And I forgot it. This is probably look like to me the 10th year, but it's get, as we would say, gooder and gooder, better and better. And the enthusiasm and the care that these individuals from the Head Start and Women's United and our district Congress and our state convention and our ministerial association and the Head Start, we got a great team. Actually, it's better than the team. We're a family. There's so many times that if on the webinars and the training session that we talk, we recognize, believe it or not, birthdays and wedding anniversary, and certainly if there's a tragedy that a family member has, we are close connected. So let's get involved. Be a part of this family. That's what I'm going to ask. Be a part of this family that is sharing information this evening on the Affordable Care Act. What a great day. November the 1st. They are open enrollment. Just look back for years ago when we could not do this, when there were preconditioned to where people, pre-medical condition, they could not get insurance because you had a condition that they would not cover. But look at us now, and there are many stories and successful opportunity that people have shared with us even today. So we look forward to what we got to do in the next couple of months for this great information that we're going to share. Thank you so much.
All right. Thank you, Pastor Montgomery. Now we go to Team Head Start North Mississippi and Tish Dean. Tish.
Hello, good evening, everyone. I am Tish Dean, and I'm from Oxford, Lafayette County, Mississippi. I work for Head Start, and I also am a navigator and a sister for Oak Hill. So what I'm about to do is give you a number that you've probably heard about 3,520 times. So this will be 3,521. 662-298-3584. And the reason I'm giving you this number is because you will come in contact, if you call this number, with some world-class navigators and assisters and people who can give you the information you need so you can live a healthier life. And that is very important. Today is November 1st, 2022. This is the first day of open enrollment for the Affordable Care Act. So when you call, they can give you information. They can assist you with, I say they, we, whoever you get in contact with. They may say, okay, call Tish Dean, she can help you too. But help you with starting a healthcare.gov account. And that's going to open you up to all the information is out there on the different plans. Once you give all your information, the necessary information, you'll see what you're eligible for. There are some wonderful plans. There are some new plans, providers, healthcare insurance companies this year. So you're going to probably come across something that's really going to be beneficial to you. And the things about the Affordable Care Act and these health plans, you know, and so many people have mentioned throughout the day, you can't be excluded if you have a pre-existing condition. And many of us do have pre-existing conditions. Most of, you know, a lot of this is affordable to you, where in years past, it wasn't affordable. I know a lot of people use the emergency room as their primary care. And like Dr. Minor said a little while ago, they're only going to patch you up. And if you look on your paperwork when you leave the emergency room, they're still going to tell you in 2 to 3 days, go see your primary care physician to get follow-up and the necessary referrals or treatments, you know, that you might need. And you know, having health insurance it may keep you from getting a huge bill from the hospital or the emergency room. Now, I'm not saying that everything is going to be free. You won't have, you know, a copay or a deductible you need to pay or something like that. But maybe $100 versus $10,000 for a hospital stay or an emergency room there's a big difference. You know, that can, you know, be detrimental financially to you and your family. You know, if our navigators and assistants can't, hook you up with the plan that you need or that's suitable for you or within your budget. And Medicaid or CHIP, don't fall into the category of what you need for you and your family. Then there's the federally qualified community health care centers. They're all across Mississippi. And, Erin Henry was on this morning, and the young lady spoke, Lakedra, I think that's her name, Lakedra Giles. She spoke about how they get your information and you just bring like check stub and a bill that's in your name, and they can put you on a sliding scale fee. And you may pay $20 or $30, So there's something out there for everyone. You just have to call us. And the number, once again, is 662-298-3584. Okay. So within that, those of us who work for Head Start, we've been doing outreach for a while now, trying to reach out to get the children and the families. So, and we're continually doing that. But in that process, we're also reaching the different communities. And I think Abigail mentioned earlier, she gave you the counties that we cover, which are 14 counties across North Mississippi. So within those 14 counties, we're just trying to reach everybody that will allow us to come in and then just give you a little bit of information. I got a question the other day, a good friend of mine, I asked her, we talked last year about signing her husband up. And I was like, well, you still thinking about, getting some insurance for him, whatever? You still selling insurance? And I had to let her know, I don't sell insurance. I just give some good advice and try to help you as best I can. So, if you call that number, a lot of misconceptions that people have, we can straighten it out and get you headed in the right direction. So, that's something we're not trying to sell you insurance. We're just trying to get you to be a healthier you and put you with the right necessities that you need in order for you to get to that point. So basically, I just want you to take what I've said, consider giving us a call and letting us assist you in any way that we can. If you choose a plan and you start your payments and you're enrolled by December 15th, then by New Year's, you can start on that New Year's resolution of having a healthier you, because you can start getting those preventive services that you need, whether it's mental health, mental wellness, mammograms, different things like that, that's going to keep you healthy. You can get started on that. And that'd be a wonderful New Year's resolution for a lot of people, just to get healthy, stay healthy. And this may be a part of it. But the important thing is just to give us a call and let us help you figure out what works for you. So with that being said, yes, ma'am.
Kish, I got a quick question for you. I don't know that I have a mental illness, but sometimes during this coming out of this pandemic, I just need someone to talk to. Is that covered?
Well, if I'm not mistaken, I do believe that there are the coverage is for you to be able to talk to someone.
Yes, it is. That's right. Most definitely.
If I'm not mistaken, yes, that's included. That's
yes,
part
it
of the
is.
overall wellness, mental
this
wellness.
Pandemic has really worked on my mind and my nerves, and it's just like I'm still in a little stressful, but I'm making it every day. But I'm still just a little stressful, just sometimes a little tense.
Well, I will say you are not alone. I promise you. The pandemic did a number on a lot of people, myself included. It was, you once you're isolated for so long and you can't go see this person, that person. My thing was I couldn't go see my grandma. And that was a big thing for me. So that played on me. My wellness or whatever. But yes, in these plans, you can address your mental wellness, whether it's just talking to someone or whatever you need. If you need medication or whatever, you just have to find the right plan for what you need.
Okay, thank you so much.
You're welcome. Anything else?
Yeah, just one more thing.
Okay.
So I can go to a regular insurance agent to get coverage for a plan, for them to help me with the plan. So they get paid. Did you say that you don't get paid for insurance, helping people with their insurance? The company like Cigna doesn't give you any money, and
no,
doesn't give you any money.
Cigna, Humana, United Healthcare, I don't get a dime, a paycheck, a mention, or anything from them. I don't get anything.
What?
No, ma'am, I do not. I'm strictly there to help. None of your premium will go in my pocket.
Oh, that's good. Because insurance agents have approached me about helping me through the marketplace. And I wanted to know. Thank you.
Yes, ma'am. All righty. If there's nothing else, I'm going to sign off. Ms. Catelli blew the whistle and got us started for Team Head Start. So I'm just going to sign off saying thank you so much for allowing us to be a part of it. We're here if you need us. And let that number once again, for about 4,000th time, is 662-298-3584. Thank you.
This is a big deal. At healthcare.gov, millions more people can afford health coverage. Due to the COVID relief law, you can pay less with financial help. In fact, 4 out of 5 customers can get a plan for under $10 a month. From doctor visits to preventive services to prescription drugs, these are quality plans. You can do this. Mark your calendar. Open enrollment starts November 1st at healthcare.gov. At healthcare.gov, millions more people can afford health coverage. In fact, 4 out of 5 customers can get a plan for under $10 a month. Open enrollment starts November 1st.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Encontré un plan que está buenísimo. ¿Tú también deberías hacerlo?
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Para mí es fundamental tener un seguro médico. Con la nueva ley puedo encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
I just wish more people knew how easy it was to get health coverage. I'm only paying $52 a month, but there are quality plans for even less.
My job doesn't offer health insurance, but with the new law, I found an affordable plan and only paid $47 a month.
Actually, a friend of mine recommended healthcare.gov, and now we're paying less than $60 a month for coverage.
I was skeptical at first, but it is real. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov. You know, I wish people knew how easy it was to get health coverage. This new law has made it so affordable, I'm only paying $52 a month, but there are quality plans for even less. New law, lower prices, more people qualify at healthcare.gov.
I went back to college right when I had to get off my dad's health insurance. So the new law came at a really great time. For $14 a month, my plan covers my meds, doctor's visits, vision, and dental.
New law, lower prices, more people qualify at healthcare.gov.
With me working part-time, my company does not offer health care. I was paying out of pocket until I heard about the new law. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov.
A friend of mine recommended healthcare.gov. I went to the website, put in all of our details. I was astonished at how much money we would be saving. Now we're paying less than $60 a month for coverage.
New law, lower prices, more people qualify at healthcare.gov.
Yeah, we are pregnant. We're having a baby.
The new healthcare law couldn't have come at a better time.
Yeah, because when you're pregnant, you need a lot of doctors.
For less than $30 a month, the whole family's covered.
New law, lower prices, more people qualify at healthcare.gov.
I'm pretty active, so I was happy to hear about the new law. I just plugged in what I needed. 20 minutes later, I picked a quality plan for less than $20 a month. So I'm covered for whatever I want to do.
New law, lower prices, more people qualify at healthcare.gov.
My job doesn't offer health insurance. With the new law, I found an affordable plan and only pay $47 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're both self-employed, and we couldn't find coverage anywhere near as affordable as healthcare.gov. Thankfully, we were able to find a plan for only $180 a month.
New law, lower prices, more people qualify at healthcare.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley, más personas como yo podemos encontrar un plan económico en cuidadodesalud.gov.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de diciembre en cuidadodesalud.gov.
Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov.
How brave are you?
Like this much.
That much?
I love you, Dad.
I love you, baby.
Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov.
I want muffins.
New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov. Take care of your joy by signing up for healthcare at healthcare.gov. New law, lower prices. More people qualify at healthcare.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley, más personas como yo podemos encontrar un plan económico en cuidadodesalud.gov.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
En cuidadodesalud.gov encontré un plan de salud que me cubre desde las visitas al doctor hasta mis recetas médicas. Tengo la tranquilidad de que mi salud está cubierta.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Siendo tutora trabajo con muchos niños, por eso para mí es fundamental tener un seguro médico. Con la nueva ley pude encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Encontré un plan que está buenísimo. Tú también deberías hacerlo.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
Mi trabajo no me ofrece seguro médico, pero con la nueva ley encontré un plan económico en cuidadodesalud.gov.
Necesito asegurarme que mi familia esté cubierta, así que conseguí un seguro médico y califiqué para ayuda financiera.
Para mí es fundamental tener un seguro médico. Con la nueva ley pude encontrar un plan de salud a muy bajo precio.
Nueva ley. Precios más bajos. Más personas califican. Inscríbete antes del 15 de enero en cuidadodesalud.gov.
You know, I wish people knew how easy it was to get health coverage. This new law has made it so affordable, I'm only paying $52 a month, but there are quality plans for even less. New law, lower prices, more people qualify at healthcare.gov.
I went back to college right when I had to get off my dad's health insurance. So the new law came at a really great time. For $14 a month, my plan covers my meds, doctor's visits, vision, and dental.
New law, lower prices, more people qualify at healthcare.gov.
With me working part-time, my company does not offer health care. I was paying out of pocket until I heard about the new law. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov.
A friend of mine recommended healthcare.gov. I went to the website, put in all of our details. I was astonished at how much money we would be saving. Now we're paying less than $60 a month for coverage.
New law, lower prices, more people qualify at healthcare.gov.
Yeah.
Yeah, we are pregnant. We're having a baby.
The new healthcare law couldn't have come at a better time.
Yeah, because when you're pregnant, you need a lot of doctors.
For less than $30 a month, the whole family's covered.
New law, lower prices, more people qualify at healthcare.gov.
I'm pretty active, so I was happy to hear about the new law. I just plugged in what I needed. 20 minutes later, I picked a quality plan for less than $20 a month. So I'm covered for whatever I want to do.
New law, lower prices, more people qualify at healthcare.gov.
My job doesn't offer health insurance. With the new law, I found an affordable plan and only pay $47 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're both self-employed, and we couldn't find coverage anywhere near as affordable as healthcare.gov. Thankfully, we were able to find a plan for only $180 a month.
New law, lower prices, more people qualify at healthcare.gov.
We're having a baby, so the new law came at a perfect time. For less than $30 a month, the whole family is covered.
I love my job and it pays really well. There's just no health coverage. For $182 a month, I found the perfect plan.
All that stress about coverage just went away. For $14 a month, my plan covers my meds, vision, and dental.
Now, more people can get financial assistance. What you pay depends in part on how much you make. New law, lower prices, more people qualify at healthcare.gov.
We're having a baby, so the new law came at a perfect time.
For less than $30 a month, the whole family's covered.
I was skeptical at first, but it is real. I'm covered with no monthly payment.
We're both self-employed, and we couldn't find coverage anywhere near as affordable as healthcare.gov. Now, we're both covered for only $180 a month.
I just wish more people knew how easy it was to get health coverage. I'm only paying $52 a month, but there are quality plans for even less. New law, lower prices, more people qualify at healthcare.gov. I just wish more people knew how easy it was to get health coverage. I'm only paying $52 a month, but there are quality plans for even less.
My job doesn't offer health insurance, but with the new law, I found an affordable plan and only pay $47 a month.
Actually, a friend of mine recommended healthcare.gov, and now we're paying less than $60 a month for coverage.
I was skeptical at first, but it is real. I'm covered with no monthly payment.
New law, lower prices, more people qualify at healthcare.gov.